weekly town hall virtual meetings. And we're very happy to have all of you join us again this week. We have a great panel tonight. Tonight we have with us Nadine, who is the president of Nason Place. We also have Erica Rowe, who is the director of community resources at Partnership for Children of Essex, and we also have our director, Monique Griffith, is with us tonight. And we're looking to have a great discussion about what resources out there and the partnerships, especially for our families right here in the city of East Orange. So we're very thankful for all of you joining us this evening. You know, we have been really having these weekly meetings to keep the constituents informed of what's going on, what programs are out there, what assistance are out there. But for you to join us, please, the number is 857-799-9641. So I'm going to give you that number again. For you to join us by Facebook, please call 857-799-9641. And before we start with our panel, just want to give you some quick updates. You know, the weekend is coming, the holiday is coming. Just want to inform all our residents who are used to the food distribution, there will be no food distribution on this Friday or this Saturday. We would resume on Tuesday at 11 a.m. So again, there will be no food distribution on Friday or Saturday because of the holiday, but we are going to resume on Tuesday at 10 a.m. So we just wanted to let everybody know that. And don't forget, Friday night, our movie night at Campus High School. That is September the 4th. Please join us. I know that folks have already went online and reserved their spots. So please join us for the movie night. It's a drive-in movie, and also people are able to sit outside, social distance with your family. Again, you can sit on your cars or you can sit in your car. So again, please join us this Friday for our drive-in movie over at Campus High School. And also, if we don't get to this, we just want to also welcome our young people back to school. We know for a fact that during this year, our young people have really not only made history because of this pandemic and this COVID-19, but also you guys are really our heroes because you have been through a lot. But again, we're starting our 2021 school year, and we would just want to welcome all of our students back to school. We want to welcome back the teachers. We want to welcome back our maintenance people. We want to welcome back all the principals, the folks from the Board of Education, but we really want to commend all our parents. So if you're going to school pandemic, although you hear the governor, our governor Phil Murphy, is starting to, you know, open the stores and open gyms and allowing us to go inside the restaurants. Dr. Griffith is going to just give you an overview on the importance of all of us still, I'm going to use that word again, still stand vigilant and making sure we still practice social distance and making sure we continue to wear these masks. You have to wear your mask, it's important. And again, when our kids are out playing, making sure when you get an opportunity that they wash their hands and up to 20 seconds, as they say, but you can do 30 seconds if you want. That's good with us also. So again, I'm going to ask Dr. Griffin to give us an overview of our COVID update, and then we're going to go right into our conversation with Nadine and Erica Rowe, because we're excited about some of the things they have been doing with their organizations right here in the city of East Orange. So again, Dr. Griffin, can you please give us an update on the COVID-19 for September the 3rd?
Good evening, everyone. As the mayor mentioned, it's still important, despite the changes that we're seeing come down from the state and Governor Murphy, to still remain as vigilant as you have been because COVID is still present. Within the state, we have seen an increase in 2,360 positive cases of COVID since last week's town hall, which means as of today, there are a total of 192,973 positive COVID cases in the state. And again, it's a cumulative number. As far as the COVID-related deaths are concerned, there has been an increase in 47 also since last week, bringing the state total to 14,188 COVID-related deaths since the beginning of the pandemic. Here within the county, we have a total of 20,187 positive cases, which is an increase in 199 cases countywide since last week. And as far as the COVID-related deaths within the county is concerned, there's an increase in 12 deaths, COVID-related deaths, which brings the total to 1,865 COVID-related deaths within Essex County. The number of negative cases continues to increase as well countywide. So again, that's a testament to all of the individuals that are taking testing seriously, as you should, and making sure that they have an understanding of what their status is. And many are finding out that they have actually tested negative. And so the total number of negative cases that we have are currently 148,748. And so that's an increase in 1,399 cases since last week. As far as what's happening here in the city, we here have a total cumulative number of 2,055 positive cases of COVID, and that represents an increase in 16 cases since last week. Our total number of deaths since last week has remained the same. So that has not increased. We haven't seen anybody or any additional cases or reported deaths since last week, which is certainly a good thing and one that we hope will continue. But again, as the mayor mentioned, the governor is and has decided to reopen gyms. He's reopened indoor amusement and water parks as well as of September 1st. As far as indoor dining, that is set to resume as of tomorrow, September 4th. And so we know that there are a lot of questions about what's occurring even with our parks, since all these other things are reopening, and just know that there are plans being put in place to address the parks and what can be done within the parks. But keep in mind what I've been mentioning as far as the flu season is concerned. We're embarking upon the flu season, so we still want to be very mindful of the fact that we're entering into the flu season and there's that potential to have 2 respiratory illnesses at work within our community at the same time. And so we want to make sure that everybody continues to remain safe and remain healthy. And so in order for you to get tested, if you're looking for a resource outside of the other resources that are available within the community, our testing site is reopening. As I mentioned, there will be 2 testing dates in September. The first testing date is going to be tomorrow at our Elmwood Avenue location, which is 161 Elmwood Avenue. Proof of insurance and proof of residency are both required. And the testing site is opening from 9 a.m. and will close at 1 p.m. So you can schedule an appointment if you are able to, but if you're not, you can certainly just walk into the site and still obtain the test, the swab test, as well as the COVID test. And the second date for our site is September 18th. So tomorrow and September 18th are the 2 testing dates in September at the Elmwood Avenue location. But again, if you have any questions related to that, you can always feel free to call the health department at 973-266-5480. And lastly, we've had a lot of questions about vital statistics and marriage licenses, birth records during this period of time. And do know that we are still fully servicing the community. So if you're in need of records, please call Vital Statistics because they are only open and services are available by appointment only. And so if you are in need of services, please call them so that you can schedule an appointment. Their number is 973-266-5450. Again, we thank you for everything that you've been doing thus far to continue to keep our numbers relatively stable here within the city. We encourage you strongly to continue to do the same so that we continue to keep the community safe and healthy.
Thank you, Dr. Griffin. Listen, we've been doing this again for 25 weeks. You've been hearing it from the doctor. Keeping yourself vigilant, keeping yourself social distance, keeping yourself hand sanitized, making sure when you're going to these stores and these beauty salons. So I do want to point one thing out tonight before we go and have a conversation with our panel, right? We're asking all of you to be our help. We're asking all our residents, if you walk into a beauty salon, if you walk into a barber shop, if you walk into a restaurant, because we're starting to open, and they do not have a face mask on or cover their face, then you need to call Dr. Griffin's office, need to call the health department, or call the police department. We cannot ask you to do your part by wearing the face cover, by also when you're in an establishment, wearing the gloves and sanitizing the place, and the establishments are not doing it. We need your help. Please call our health department. Please call our police department. Those numbers will be listed on the Facebook page, but we also need you, as I always say, to help be our eyes and ears and be our police officers also. Our police department cannot do it by themselves. Our health department cannot do it by ourselves. Our city officials cannot do it by themselves. We need your help, we need your support, and we need you to call when these things are happening in our community. So with that, we're going to get started because we're going to have a great conversation tonight. And we're going to start with Nadine, who I know really for quite a long time, and she has been doing and continue to do an excellent job with Nason Place. So Nadine, thank you very much for being on our virtual town hall meeting tonight. You and your organization has been a pillar in this community. So I just want you to take time out and introduce yourself to the folks out there. And can you please tell our viewers what Nason Place is all about and what you're doing in the community with your organization?
Well, first off, Mayor Green, I want to say thank you for allowing me to be a part of this town hall so that we can share valuable information. To the families that are in our community that are affected by autism. First and foremost, my name is Nadine Wright Arbubaka, and I am the proud mother of a 16-year-old nonverbal autistic son. Back in 2006, when my son was diagnosed with autism, I set out on a journey to find out as much as I could about autism. I didn't know what it was. I heard of it, I just didn't know what it was all about. Hence, it led me on a journey to try to find resources in my community. I am a resident of the city of East Orange. I am born and bred in the city of Newark, so this is my home in both cities. And when I couldn't find programs, I wanted to understand why. And the answer was we needed to be able to become part of a solution to a problem that was happening in and around urban inner cities. So as I started this journey, I realized that in order to get our children what they needed so that they can stay in their own community, we needed a resource, and that resource turned out, and to be inspired by my own son, Nason. I started an organization back in 2012 called Nason's Place. And Nason's Place is an organization that is helping to enrich and make a difference in the lives of children and families affected by autism in and around the Essex County community. So we continue to provide much needed resources such as programs and webinars and support groups. But most importantly, we're letting people know who have children affected by autism that you're not alone. And I think it's very important for us to be able to educate our community because we can't expect our community to help support us if they don't understand what autism is.
Good. So, we can go right into the segment. So, with your organization during this COVID, right, you had to adjust. Tell the folks some of the things that you and your organization had to do during the COVID, especially with some of your resources and with the families, and tell them how you dealt with this pandemic during this time.
Well, I can tell you that our parents were already challenged before the pandemic. They were even more challenged with the pandemic. Our children need a lot of support, and a lot of times our parents can't provide all of the support, such as OT, such as speech, such as ABA. A lot of our parents have multiple children, so a lot of our children regress because they weren't getting the supports that they were accustomed to getting, whether it was in a school setting or out of school setting. So it was overwhelming. A lot of our families could no longer go to work. And I will say maybe about 80 to 85% of the families that we serve are single parent households who are working and can't afford to miss a day of work. And unfortunately, a lot of our parents had to either leave their jobs or give up their jobs so they can be home with their children. So this led to a couple of things. It led to regression in the children. What these children were accustomed to in terms of routine was now gone. What they normally were able to do, go to school, come home, parents who were able to go to work couldn't do those things anymore. And one of the things that people did not realize, and I think it hit all of us in a different way, but parents of single parent households who, are living check by check, they weren't used to buying breakfast and lunch for their children during the day. And now, wow, all of a sudden COVID happened, and now they have to now figure out how do they get food in their houses. And that was one of the challenges we had. We were helping families with food. We're giving out ShopRite gift cards. We had to go out and purchase sensory items because we wanted these children to try to have some type of normalcy with them being home. So we were able to provide tablets. A lot of our families, even though school districts were giving out Chromebooks, but if there's multiple children in the home, some of them were only getting maybe 2 Chromebooks in their home if they had 4 kids. A child on the autism spectrum doesn't understand it's not your turn right now and you have to share. So we had to go out and purchase these items so that we can try to make some type of normalcy for these families. But we did webinars, we offered support. We even did in-person respite when we were able to, and finding others, because these families truly needed that support, and
Right.
we still need it.
Right. So, listen, I really know what your organization stands for. I know what you have been doing, but there's a lot of parents probably on tonight and joined us, right? Talk about when it comes to autism, right? And talk about families that's out there that haven't yet identified their child or adult that has autism, and what programs are out there, how they should feel, what resources out there, and what Nason Place offer to those type of families. And from your experience, how people should attack the autism piece, because some families are ashamed of thinking there's something wrong with their son or daughter and don't know where to go. Talk about that.
Well, there's a lot that can be said, but first and foremost, I want to say that those of you who see the signs, please do not ignore those signs. If you see your child doing behaviors that you find a little strange or odd, question that. One good thing I can tell you, for me, when my son was going through, I noticed something right away. He stopped responding to his name. And I did the first thing that any parent would do is you go to your pediatrician. Pediatricians, and we're going back now 14 years ago with this diagnosis, unfortunately. And let me give you some statistics here. New Jersey currently has the highest rate of autism in the country. The highest rate, 1 in every 32, I believe it is now. And the numbers are growing. And the amount of resources in and around urban inner cities are far and few between. So, if you see these signs, don't ignore it. The good thing about the state of New Jersey is they do have a lot of programs now that can identify and help these families out here who are looking for some type of support. Early intervention is out there. There's a wealth of information that I can tell you didn't exist 14 years ago that now exists. The state of New Jersey has done a phenomenal job in getting out information and trying to help families get early detection and sending supports into their homes. But the parents also have to do their part. And Ted, you touched something really interesting, because a lot of people are ashamed to have their child labeled. I'd rather have my child labeled and getting him the supports that he needs early on than to not have him labeled and not getting what he needs and go into adulthood, and it's a whole different ballgame for him. So it's important that you don't ignore the signs. You get the help that you need. There is help out there. Nason's Place, as I said, was started 8 years ago because I wanted us to have more resources. I wanted more to happen. And, over the last 8 years, amazing things have happened. For example, one big thing, and I'm going to talk about that a little in depth later on in a webinar that we're doing, but the state of New Jersey is now paying for something called ABA services. Applied behavior analysis. It's a proven technique that helps children who have behaviors. And a lot of our children do have behaviors that are different from what other children will have. And they need more help or assistance. And there was a time when the insurance companies, if you had private insurance, they would pay for that service. And the state through Medicaid would not, and those families who didn't have private insurance missed out on this much needed resource. So I'm very happy and I'm thankful and grateful to an organization called Autism New Jersey who spearheaded in getting that service done so that these families can have those services in their homes like everyone else.
Right. So, and not to cut you off, and I'm glad we having this discussion, because here we are back in the 2021 school year, right? And there's many parents that are still trying to find ways that, the kids need to go to school. But we know for a fact when it comes to children who have autism, there's special needs that they need, right? And there's certain classroom settings that autism is no different than kids who have a learning disability, right? Let's talk about that a little bit, because there's parents out there who right now, they want to keep their kids safe, they want to keep their kids healthy, but again, they have to make a decision to either leave them home remotely or put them in a school setting where the professionals are. Talk a little about that in terms of autism.
That is a very difficult choice.
And you can look at me sometimes.
That's a very difficult choice for these parents. And, unfortunately, autism is a huge spectrum, so each of our children are different in terms of how they learn.
Right.
There are some children who are on the high end of the autism spectrum that you can put in front of a computer and will do the remote learning. And then you have children like my son, Nason, who is on the lower end academically, and he's nonverbal, who's not going to sit there. So it is definitely challenging in getting that done. And how do a parent do that? You got to get your support, or your village, so to speak. And there's no real answer in these unprecedented times for it. But I think if we all come together collectively, and that includes the school districts, the family members in these homes, we work with each other and we try to help each other. It could definitely bridge some of the anxiety and challenges that these families have. But it's not a one size fit all. Because during this whole COVID process or pandemic, I had a lot of families who were saying, oh, I want my kid to still get their services like ABA and like speech and OT. And then, okay, now you got it, but guess what? It has to be remotely. But that means your ABA therapist, the OT, and the speech person can't come to your home. So how do you provide that? You as that parent now have to sit there and you have to go through the process, because that person, for safety reasons, can't come into your home. And, I had parents complaining, well, how am I supposed to do this? I said, you got to think about it. It's a twofold, right? We want the services for our kids, but we have to also understand the safety piece of it. So you can't have it both ways. You can't have your child getting the services remotely if you can't be there with them. And that child, like Nason, I couldn't sit him in front of a computer by himself. It's just not going to work. So for me, it wasn't beneficial to have him get his OT and his speech and his ABA. What was really fortunate for me is that I get ABA services for my son through my private insurance. Parents, please, if you have private insurance, some of you may not know this, they will pay for in-home support for you. You can still get ABA services. My ABA therapist actually lived 3 blocks from me. Right. So Nason through COVID was still getting his resources. But it's important that you know the resources that you have available to you, because there's many. Perform Care is a state-ran agency out there now that will provide some types of resources for our families. I mean, we're in COVID mode now, so you're not going to be able to get the after-school programs that they will provide or the Saturday respite.
What are some of the numbers, or if because I always like to make sure that our residents and folks who are on our meeting tonight, give them a number where they can reach you, your organization, your website. People need to know that, because it's a resource. So give that number out so folks can have it, please.
Well, the name of the organization is Nason's Place. Our phone number is 973-424-7781, and the website is www.nasonsplace.org. And I just want to also point out that some of the things that we had to do talking about COVID is, we usually do a summer program, and I got to give a big thank you to the City of East Orange and to you, Mayor Green, because they were the first municipality in this area to offer a full-day autism summer camp for children with autism for 2 years straight, and then COVID happened this year. But Nason's Place was able to offer a summer camp, in conjunction with St. Matthew's AME Church. So there are things that Naissance Place is still providing to the community. We're providing sensory-friendly bags. We're getting donations donated to us where we're giving out detergent, we're giving out food. In certain cities, we have families on the list where they get Hello Fresh. So we're out still in the community trying to make sure that we provide for our families, and we will continue to do that.
And thank you for that. And listen, you gave out a lot of information, and I know those folks who joined us really appreciate that. But I'm gonna bounce right to our friend over here, Erica Rowe, a Partnership for Children of Essex County. Thank you so much for joining us this evening, right? So, Erica, as you heard, Nadine, see, sometimes she called me the man, sometimes she called me Ted, so you heard two different names tonight, but it's okay, she's my friend. But, Erica, give us an overview of who you are, what's your organization about, and also, what are you doing in terms of providing the services through your organization?
Okay. Thank you very much
You're welcome.
for having me, first
Yes.
of all. On behalf of the Partnership for Children of Essex and our Executive Director, Victor Alvarez, again, thank you for having me.
Yes.
The Partnership for Children of Essex has actually been around for the last 16 years. We are a care management organization under New Jersey Children's System of Care. So there is an agency like ours in every county. However, the Partnership for Children of Essex is the one for Essex County, and the best, I may add. So we're providing mental health services for those children between the ages of 5 and 21 that have significant behavioral and emotional difficulties and challenges, those with substance use challenges, as well as those with developmental disabilities.
Wow. Okay.
So that's the focus of the youth that we're serving currently. Right now, we probably have about 1,300 families that we're serving here in Essex County, with many of them coming from the city of East Orange.
Wow.
So it's very important that families know what their resources are here. I want to talk a little bit about just the access to services how do you actually access us.
Okay.
So there is a centralized hub called Perform Care, and many people have heard of Perform Care, but we want to make sure that you're able to actually get them and get the services that you need. Perform Care is pretty much a centralized hub where anybody that has a concern about a particular youth between the ages of 5 and 21 can reach them. It's an 877 number that I'm going to give. It's 877-652-7624. And that number is available 24 hours a day, 7 days a week for families to reach out to gain services. So this centralized hub, what's going to happen is that anybody that has a concern can contact Perform Care. Perform Care will pretty much triage the family over the phone, ask a bunch of questions, see what some of the needs are, and they will actually send someone out to the home to do an assessment.
Okay.
This is very convenient for many families. Families do not have to leave their homes, but that person will come out and do an assessment and see what services may be needed for that particular youth. The care management organization is considered a higher level of care.
Okay.
So what would happen is that assessment, it could go in one of two ways. The first would be that the families offer just basic community resources that are out there, maybe the outpatient therapy, things of that nature. But if that youth presents to have needs that are of a higher level, then they would be referred to the Partnership for Children of Essex. Once they come to us, they will be assigned a care manager that will manage all of the resources that the family would be receiving, and they put together what's called a child and family team. So anybody that knows that child the best can be a part of the child and family team process. So once the child and family team has been established, then they talk about the strengths and the needs of that particular child, and then services can be put in place.
Right. So, and this is good because you think about it. Nadine spoke about autism, and then you're speaking about the mental health, right? And when we talk about families right here in the city of East Orange, because this is what I represent, but it's a twofold, because we just talked about how families should identify a kid or a teenager that has autism, and then it comes, how do you identify, because the ages that you are providing service to, 5 to 21, how do a mother or a father or a parent identify a child or even a teenager that's having mental illness? How do they identify those people, and what type of help they should go seek first to identify them?
Well, we can provide whatever evaluations
Okay,
that are
all
needed
right.
for youth. So if a child requires a psychological, psychiatric evaluation, we are able to put those services in and find out what the recommendations are from the professionals
Okay.
in terms of what that child would need. I just want to add to
Okay,
that,
yeah.
so part of my role is to make sure that there are enough resources out here in the
Right,
community.
right.
As a community resource director, they think I'm like a walking, what's that phone book, this should be
Okay,
411.
encyclopedia, right. Okay, I got you.
But, so yes, so some of the services that the Partnership for Children of Essex actually can provide to families would be, it could be a gamut of different services, because the services are very individualized.
Okay.
It's not a situation where every family will get the same thing at the same time. It's not a cookie cutter situation. We're really looking at the strengths and the needs of that particular child, and then we're putting in resources in reference to that.
Right.
So part of my role as a community resource director is to first make sure that there are enough resources out here in the community,
Okay.
which we know that there are a wealth of them. But we want to make sure that they're funneled to the correct resources at the time of need. So some of the resources that the youth that come through the Partnership for Children of Essex has access to would be in-home services, which has been tremendous for a lot of our youth.
Okay.
Because it's very convenient for families.
Right.
You do not need to go outside of your home. We have behavioral assistants. These are professionals that are coming into the home and they're changing the behaviors. All of their interventions are around changing the behaviors of youth to have them be successful. The in-home services will have, they call it in-community services, where therapists are actually coming to the home and they are providing therapy to these families.
Right.
Again, very convenient, non-traditional, where you're not going all the way to an outpatient facility at that time and being grilled with questions and then, coming out. These are people that are working directly in the home,
Right.
or they're able to take these youth and families outside of the home if it's not conducive for the home.
Right.
They can work in a park, they can work outside, anywhere that it's comfortable for families.
So, and thank you for that, Erica. During this COVID, everybody had to kind of shift, right? And just earlier you talked about some of the folks who was able to come into the homes. How does your organization deal with providing service during this COVID?
We never close shop. I mean, the families that come to us, there's never a waiting list or anything. Our services are immediate. So as soon as we get the referral from Perform Care, our care managers begin work with the families.
Right.
During COVID, we were fully operational. We still are.
Okay.
There had to be some adjustments, obviously, in terms of our care managers going out into the home. So they were seeing families virtually
Great.
and using telehealth. So a lot of our providers are still using telehealth. I think now that the governor is lifting things a little bit,
Okay.
providers are more comfortable going into the homes as needed.
Okay, so question, give us a example, right, of wraparound model of care.
So when we
I-
say we provide wraparound services,
Yeah,
or
give me that
wraparound
wraparound
model of
stuff.
care,
I like, you
it's
know.
pretty much just what it says. It is wrapping services around youth and families so that they can be successful.
Okay,
A lot of times when I'm explaining it to families, I'm saying it's almost the concept of it takes a village. It's a combination of various resources that are needed for that particular child to be successful, for that family to be successful, for them to actually reach their goals and whatever they're trying to do. So that's pretty much the wraparound model of care. We're wrapping services around the children and families so that they can be successful.
And that's very important. You know, during our meetings, we have folks who have you know, questions. So what I want to do, because I got some more questions for y'all now. You know, I got a whole lot of stuff here, and we can get some things answered. But I want to go to our Facebook questions, right? Normally, folks come on and they have questions, and we want them to ask questions and be able to get the answers from each other. So I want to ask Connie to give us some Facebook questions that people chimed in on.
This question specifically is related to special needs, and hopefully Erica will be able to answer. Schools for the blind, are there any services that can help students who have vision issues?
Yes, there is the Commission for the Blind that offers services to those youth and families that may be struggling to obtain services in that respect. I don't know, did they elaborate any more in terms of, I know the Commission for the Blind is able to assist with services.
Okay, so Commission for the Blind.
Correct.
And that's the only question we have related to special needs. Do you want to go to other questions outside of this, or you want to come back?
We'll come back, because I really want people to chime on the special needs conversation, and I wanted people to chime in on you know, the autism, and just, you know, wanted to hear from parents, because I know that during one of our town hall meetings, we had our school district members on, Dr. Harvard, Ms. Champagne, we had Ms. Santos on, and we had our superintendent, Mr. Hassan, and quite a few questions that came through. You know, most parents were concerned about the health and safety of their child, which they supposed to. But we also had quite a few parents and adults on our Facebook and our phone had questions about autism and special needed kids. So we thought this was so fitting to have both of you on, because we know that there's a population in our community that need these services. You know, we have been, from day one that I walked into office, have been working with our nonprofit organizations, for-profit organizations, and making sure that we created through my office what we call a resource guide, right? And you in there, you know, y'all guys in there. And that was for when people called the office, we was able to at least refer people or direct people to the right source. You know, we knew that it wasn't our expertise in terms of autism or mental illness. And any of y'all can answer this question, right? We're starting to see around our community, right, where in some of the agencies that we do have here, that we see a lot of our, even adults and young people who are out here on these streets, right, that are going through difficulty times, right? And all of them are not homeless, because if they have somewhere to stay, they're not considered homeless. But what are some of your advice on those who, and I know most of you deal with kids, but also you can deal with adults too. What is some advice that you can tell some of the constituents that's on our social media tonight and who has joined us by the telephone on, you know, services, identifying resources? Just give an overview of how would you think that we need to attack it here in the city of East Orange.
Well, I will say this. I think it's important that everyone gets involved. It's important that everyone gets involved. Having a child with any type of disability is a challenge for any parent. But I think it's important that the parents are on board. I think it's important that the community is on board. And I think it's important that the school districts are on board. Those three factors are very, very important for that child to eventually not end up the way you just said, just out there. We have to be able to put the right mechanism And we have to work together to get it done, because it can be done. And I will say, we have too many of our children on the street corner. We need to do something more about that, whether it's mental illness. We have individuals with autism that are out there because, they're not getting, and it's a twofold. Because, the parents want to blame the school districts want to say the parents aren't doing enough. We have to work together collectively because we're all responsible for these children. And we can make the difference so that we won't have the situations
Right.
we're talking about. But we have to come together and we have to talk. And here's another thing that's very, very important. We have to meet the needs of these children early on. We have to, because if we don't, we're going to lose them, and we're losing too many. And when I say early on, these parents have to be involved, the school districts have to be involved, and they have to have the right people in these positions to make the decisions that's going to be appropriate for that child, because it's not a one-size-fits-all. And I think we can get rid of all of what's happening to our children if we start early on with the right plans, the right people in place, whether it's the parents, come together. We're all accountable, and we have to be able to make sure that our children aren't left out there. And there are resources out there for that. A lot of our parents just need some assistance in their home to have structure. Some parents don't know that if they have a child with a disability, whether it's autism, cerebral palsy, that if they have Medicaid, there's a program called Perform Preference through the state that will actually pay them to take care of their own child. We have families getting upwards of maybe $1,000 a month of extra income coming into their households to help them. Because a lot of our parents can't work because of the child's disability. And some of them don't know that this resource is out there. They don't even know that if they have a child who is 4 and 5 years old and maybe 10 still in diapers, that if they have Medicaid, Medicaid will now pay for those diapers. So there's so many different things out there that these families don't know. And I implore them to get involved, find out what you have available to you. But Erica just gave you Perform Care. Very valuable resource. I'm telling you, Perform Preference is out there. Right now, if you have a child with a disability, there's free respite care out there. So the resources are there. You can always visit Nason's Place page. We have a list of COVID-19 resources that are available. Great. And the things that we're doing. But collectively, to go back to you, we got to come together better as a community, as a school district, and as parents to make sure that we don't fail our children anymore.
Right. And so elaborate on that,
Yeah, the advice I would have is that, for parents, don't be alone, don't, if you need help, ask questions. I want to talk a little bit about, we have actually some system partners that we work with. One being the Family Support Organization of Essex County, that is located right here in East Orange, and they're providing peer-to-peer support. So those families that may be struggling with anxiety, and children going back to school, those with developmental disabilities, they have the support that they need through this one-on-one peer support. Okay. These families, the peer support partners actually, they have children that are very similar to those that come through the Partnership for Children of Essex. They have the special needs, so they understand what these parents are going through, and they can say, listen, I get it, I understand, and they can provide that support and guidance that they need. They have a ton of resources. Each week, I know they have a parent support group. They host a ton of different webinars, and again, they're right here in East Orange, so families should know about that. Their phone number is 973-395-1441. That is the Family Support Organization of Essex County. So they are one of our system partners. So what happens is any family that receives services from the Partnership for Children of Essex, they're automatically going to be offered family support services as well. So while we're working with the youth, the families are, the caregiver and the parent are supported as well. And that's very important, right, especially during COVID. I mean, we as adults are trying to make sense of what's going on. Is this our new norm, etc.? So we want to make sure that parents are supported so that they can adequately take care of their youth here in Essex County. There's another really important resource that I'd like to talk about, and that is if a youth is having a particular crisis, right away, Perform Care, the 877-652-7624 number that I explained earlier. They have what's called mobile response and stabilization services. Again, families can access them 24 hours a day, 7 days a week. If that child is experiencing an extreme crisis. They're not able to calm down. Parents are not able to, control the situation at that point. They can contact Perform Care and ask for a mobile response worker to actually come out to the home and try and diffuse the situation. And that worker would determine if that youth needs to go to probably North Beth Israel for a screening, for further psychiatric screening. So parents, again, just, reach out. Do not be alone with all of this. Do not suffer in silence. There are plenty of resources that are out there. We also manage a resource net, which is online, that anybody can access. This is an online resource directory. And that resource directory is www.essexresourcenet.org. Anybody can access that, and it has a wealth of different resources that parents can access. What's nice about it is that even if you're outside of Essex County,
Right.
They have the link to the other resource nets in every other county,
Okay.
which is nice for families as well.
Great. So, y'all touched on something that, we have been kind of embarking on, again, like I say, for the last few months that we have been doing these town hall virtual meetings, right? And from your perspective in your organizations, right, there's a lot of parents, right, who have dealt with these kids that autism, mental illness, who, they're stressing out. They have anxiety. They're at a point where, I don't know how to use the term, want to scream and, I need some relief. How did your organization, I know you specialize in working with our young people, but how did y'all deal with the parents of autism kids and mental illness kids? How did y'all deal with the parents, and the parents said, listen, I'm also stressing, even though the kid is stressing? How did y'all deal with that? How did y'all refer those parents to resources so that, as you talked about it, the situation from the kid being, at a level of stress and anxiety and anger, so it didn't escalate? How did y'all deal with that through your organizations?
I can tell you how Naissance Place was able to deal with that. One of the things we did was emergency respite. And we wanted to, parents at some point didn't care about COVID. They just wanted someone in that home to help them.
Right.
And unfortunately, a lot of them didn't have the financial means to pay for someone to come into the home.
Okay.
Or, with the state getting certain assistance, wasn't coming into the home. Everything was going to be virtually. But we actually had 2 therapists willing to go into the homes that Naissance Place was able to provide the financial means so that these parents could have a little bit of support. One of the other things that we've done, as I mentioned earlier, we did a summer camp for 10 children on the autism spectrum, which gave these parents some much needed de-stress time, but it also gave the children an opportunity to be in a setting where we kept it safe. I will say we were there for 5 weeks. It was an outdoor summer camp, knock on wood, no COVID-19 cases. We were very careful. We followed all the guidelines. And what we did last Friday is we took in 21 kids, and we did a COVID de-stress fun day.
Man,
and
y'all
we
should've
were
called me
able
on
to
that.
give, we were able to give 14
De-stress.
14 parents who had children on the spectrum an opportunity, because some of our families have more than 1 or 2 kids,
Yeah,
3.
yeah.
So we were able to give them a much needed de-stress day, which means that they dropped their children off for 6 hours at no cost to them. We actually had an anonymous donor that donated the funding we needed to pay the staff to be with these children.
Beautiful.
So, those are the things that we will continue to do. A lot of times people don't hear the things that we do, but we are paying for respite. Like families have family members that would help them with the children, but at the end of the day, everyone's still struggling, trying to pay bills.
Yeah.
And Naissance Place has been able to support that. So we probably provided emergency support to maybe about 25 plus kids over the last few months. On top of that, we also will be doing a de-stress day. We talked about the parents. It's very important that if we're not, as parents, taking care of, we can't possibly help our children.
Right,
So
right,
one of the
right.
things
I
that
agree with that.
one of the things that Naissance Place is going to be doing. Unfortunately, we can't have our normal Pamper Me Day with last year. We hosted over 100 autism moms for a day of pampering at no cost to them. But this year, you know, with COVID-19 and guidelines, we will be hosting an event for 30 autism moms to have a de-stress day without 40.
What about dads? Come on, what's up with this mom stuff? I mean, we got some dads out there that need a little de-stressing.
Yeah, they do.
Yeah.
But right now, with the times that
Okay,
we're
I
in
get it, I
and
get it.
funding,
Listen.
it's a challenge. But we're continuing. I'm on the phone, Ted, like 2, 3 o'clock in the morning. I'm talking to parents every day, 4 and 5 times a day, to say, you know, just to give them some type of relief, because a lot of times these families don't have anyone else to talk to, and they prefer to talk to someone who understands.
Yeah,
what they're
well, that's
going through.
important.
So that's how in a sound
Yeah,
place.
somebody just want to hear a friendly
Yeah.
voice or a different voice. And listen, Saint, you can answer that question too through the mental illness and through your organization. What have y'all been doing for the parents?
Correct. So the Family Support Organization, like I said, they have a ton of different resources that they can support families with. I know weekly they provide a support group virtually for any family that requires it or needs it. They can, you know, once the children are back into school, I know that they're very instrumental in terms of working with parents to navigate the whole IEP process.
Yes.
Which is, you know, that's a beast in itself, just trying to understand the lingo and the language. I'm sure you know, Nadine. But so the Family Support Organization can assist with resources in that respect. I did want to give a few other resources for families that are out there. They have what's called Mom to Mom resources, and I want to make sure that families out there have that number, which is 877-914-MOM2.
Do they have a website?
It's the same. I think it's Mom to Mom.
All
It's the
right,
number
give that
Mom
number out
to
again.
Mom.
Give it out one more time.
Yes. And also for youth, they have what's called the second floor. If there are youth that are struggling, that just feel like they need somebody to talk to. We know youth are very, you know, involved with their phone. They can actually text what they need, what kind of services that they require, how they're feeling. That second floor youth helpline, that number is 888-222-2228. Very easy for our young people to remember. On my brain, I'm old, so.
No, you're okay. You're doing great. You're doing great.
We spoke a little bit earlier, Nadine, you were talking a little bit about if parents see the signs, they should respond to it or they should inquire. And I think that it's important to note that there still is that stigma, right? Whether it's related to mental illness or it's related to a spectrum disorder, right? Or diagnosis. There's usually a stigma associated with that. And so oftentimes families or parents, they might see something and question it, but not necessarily want the label as you mentioned. But can you talk a little bit specifically for those families that don't necessarily know what the symptoms are? Can you talk specifically about some symptoms of autism and how parents might be able to recognize those social deficits or other deficits? Because it's a developmental disorder, right?
Yes, it is. It truly is. And thank you for that question. I want to be able to speak to it. And I can speak to it from my own personal experience. My son, one day, he didn't respond to his name out of the blue. And I'm like calling him and he didn't respond. I thought he was deaf. So I saw that. Not only did I see that, I also saw the flapping of the hands, which is something I was like, what is going on? He's running back and forth. So I saw signs. I went to my pediatrician. Like, something's not right. Previously, I had 3 daughters, so I never had a son. He was my only son and my last child. Something's not right. You know, my pediatrician at the time said boys are different. They develop differently than girls. But, you know, as a parent, we have that gut instinct. We know that there's something wrong. And I kept fishing, and it wasn't until I put him in a daycare setting where I had the teacher that day that I picked him up, and she said, you know, very hesitantly, maybe you should get him evaluated. And I'm looking at her like, you think so? Because I'm not crazy now, because she just kind of gave me what I needed to validate that I wasn't, and that started the ball rolling. And what she said to me, wow, I never had a parent act so excited when I told them that maybe they need to get their child evaluated. But we're mothers. Our instincts kick in. Please, I hear it too often, and I get these kids who have gone 3 years, 4 years without the proper resources that would have helped them get the services that they needed because we wanted to ignore it or we didn't want our kids labeled. Who cares what other people say or think about our children? You are that child's parent. You need to make sure you look out for his well-being. So if that child has to be labeled every single day of his life, but he's getting the resources that he can or she can so that they can lead a productive life, you're doing a disservice to them if you don't. So when you see things that you know are not atypical, but in some cases, these are brand new parents, so they don't know what to expect. But again, use that motherly instinct and you know it. Follow it. Ask someone, read up, because I actually went and started Googling flapping of the hands and, you know, not responding to their names. And I got autism, and I was like, no, my kid doesn't have that, because, you know, that's not known in our community. So, you know, but I also knew that I couldn't ignore it. So I cried once I got the diagnosis. I'm not going to tell you that I didn't. It was a life changer, right? But it wasn't, I didn't stop living. I'm still living. I'm still able to do all the things that I did before. I just do it differently. There's support services out there. Please, please get it, because you're going to need it. I'm not going to tell you that it's not an easy journey. You know, it's not a one-size-fits-all, because we have some kids who are exceptionally bright, they're living productive lives, they're going off to college, and then unfortunately we have those that will probably never go off to college, will never leave you. So please give them the resources they now. It's proven to be able to help them enhance their quality of life.
Right.
So thank you for asking that question.
Yeah, that was great, you know, and again, I commend both of you, and many of these organizations that are providing the services that all of you provide, and you know, in a different fashion, but it's all about helping. It's all about bringing resources to communities such as East Orange and other urban communities, but you know, suburban communities go through the same thing. You know, it's not just urban, suburban. It's a problem that organizations like you and all of you and the folks who sit on your boards and your committees help organizations such as to have these resources and have folks like yourself to talk to and guide us through what we need to be guided through. So we thank y'all for what y'all do each and every day. You know, it's kind of like bring us to almost a closing, and really, you know, I love the conversation. This was a great conversation. It was very enriching. It was very fruitful, and those who joined us, and we know those who stays on the line, because they see the significance of a great conversation. So what I want to do y'all have a closing or some things you'd like to say and provide before we, you know, tune out to next time? And what I want to do is, as we continue to have our weekly virtual town meetings, want to bring y'all back, you know, and continue to talk to the folks out there, because there's still a lot of folks that will say, well, I didn't even know y'all had the show tonight, or I didn't know this service was that I can use. So I think the more that we get on social media, the more we provide a conversation around autism, mental illness, the more we connect to people that's in our community, right? So what I want to do, and I'll start with Nadine, who calls me Mayor sometime and Ted sometime, but it's okay. It's okay. That's my friend. I've known her for a long time.
It's almost 30 years.
30 years, yeah. I've been on her board. She get on me when I don't come to meetings, but it's okay. A lot of people do that. But Nadine, in closing, is there anything that you want to close out with? The floor is yours.
First, I want to say that Nason's Place and organizations like us cannot survive without the support that we get from the public and private sector. It is very important that we continue to get that support. And I got to give a big shout out to you,
Thank you.
you know, for recognizing that, because one of the things I've learned through this journey is that a closed mouth never gets fed. And all the doors that I've knocked on to get resources for our children with autism been knocked down. But one of the things I've been told is no one ever asked, or, you know, I just want to say thank you.
Yes.
Because you were the first municipality in Essex County, and I want to say in the urban inner city, to offer an autism swim safety program. You guys won an award 1 year for that.
Right.
And you're knocking down doors that other cities aren't doing. And you know, it's important that a zip code is not the reason our children don't get the services that they need.
Right.
Because it is a huge disparity in suburban communities opposed to urban inner city communities. And that was why it was important for Nason's Place to exist. But we couldn't do what we do without the support that we get from the public and the private sector.
Thank you.
So thank you, and the city of East Orange for your continued support.
Right.
But I want to share that there are a lot of resources out there. Nason's Place is here. We're right here in the community. You can reach out to us. The phone number again is 973-424-7781. Visit our website. We will help you. We continue to do what we need to do because we're here to stay. I also want to let you know that there's another resources out there called New Jersey Special Needs Connection. They're on Facebook. It was started by a mom of twin boys with autism. It has everything that you could possibly want on that website throughout the whole state of New Jersey, from dentists to doctors to ABA to anything that you want. So please visit that website or go to Facebook, New Jersey Special Needs Connection. Autism New Jersey, another great organization. We're going to be doing a webinar with them in a few weeks to talk about Medicaid and ABA services. And there's still so many more out there. Visit our page to get that information, or please reach out. Once again, thank you for the opportunity to be here. And just so, one more thing I want to piggyback on, that we've actually benefited from the services through children, because some of the children they referred to our organization that was actually able to come to the summer camp that the city of East Orange offered.
And that's what we talk about when it comes to partnership. That's how we should be working. Erica, thank you so much for taking time out of your schedule. I know that you have been just as busy as Nason Place, right? And I know for a fact that the things that you do in your organization is very meaningful, right? So if you want to close out, tell people about some programs, please. It's your floor.
Okay. Once again, thank you very much for having
You're
me. What I want to say is, again, parents do not suffer in silence. There are resources that are out there. Perform Care in particular, the 877-652-7624 number. Parents that may be struggling with trying to get access to services, please, you can call us directly. You can call the Partnership for Children of Essex directly, and we can help families navigate into Perform Care and getting the services that they need. Our direct phone number is 973-323-3000, and you can press option 5 to speak with someone directly to help and navigate those resources through Perform Care. And I have a few other resources to talk about. The Family Success Centers. There's another resources out there. I know that in Essex County there are approximately 9 of them. East Orange, once again, you have one here in your city.
Yes.
That phone number is 973-395-1442. It's the Family Success Center. They have a wealth of various resources as well that families can tap into in terms of everything from food pantries and housing issues and mental health. They know that they are to refer to the Partnership for Children of Essex as a resource.
Yes.
So again, I thank you for having me, and this is a wonderful conversation. I really hope that I can come back again
without a doubt.
and speak with yourself and the city of East Orange, just in reference to the resources that are out there, because it's very important. Just trying to, this new norm, just trying to understand this new norm for everybody. So thank you again.
Right, you're definitely welcome, and you're definitely going to get invited back, because you're the only person told me that I could scream and not get in trouble, so I feel good about that. I really do. But Family Success Center, we had them on last week. They did an outstanding job providing information and the services that they provide. We want to make this a partnership. In East Orange, we constantly drive this this charge that we're one city, one community. We have one goal. That goal is progress. And what we do each and every day, we cannot do without all of you. And I really mean that, because y'all are the driving force behind the social services, the agencies, the help. And we thank y'all for that. So continue to do what you do each and every day. I'm going to give Dr. Griffin an opportunity to share with us the importance of our testing sites and some of the things you should and shouldn't be doing this weekend, during Labor Day weekend. And we're going to close out very shortly. So Dr. Griffin.
All right, thank you, Mayor. And thank you, ladies, as well, because I think it's important to talk about what is happening as a result of the pandemic, and what we've seen is that equity is important, right? You mentioned the fact that our urban centers and some suburban areas are not necessarily receiving the same types of services. And so whether it's related to, I think everything is related to health, but whether it's related to physical health, and we're talking about chronic illnesses, or we're talking about different diagnoses, it's important to remember that there is help out there. You do have to pay attention to what's going on. It's important to continue to manage your chronic illnesses. It's important to seek the support and the resources that you need so that we can all get through this particular period of time together, and also in a healthy and a safe and a strong manner. As far as the holiday is concerned, we know that that is coming up, and it's quickly approaching as well. And as we have businesses reopening, as the holidays continue to approach, just as with July 4th and some other holidays, it's still important to remember that COVID is still present. We have not eliminated it from our community, from the state, or even many states surrounding us. So make sure that you're still mindful. Make sure that as you are engaging with other individuals, you're still maintaining that social distance. Make sure that even if you decide to have a get-together, that you're limiting the number of individuals that are participating as well, because we know that everybody still needs engagement. We know that everybody still needs to connect with one another, so be safe while doing it. Make sure that you're not sharing a lot of items, because we want to make sure that we're reducing the transmission of the virus as well. And so continue to be mindful, as the mayor said before, to wash your hands and to wear your masks still, because even if you're not within 6 feet or from somebody else, you still want to make sure that you're protecting yourself as much as possible, because prevention is key. You have to prevent it. If you contract it, there are many variables involved in what the outcome will be. So I can't stress enough that it's important to prevent you contracting this particular virus. So continue to be safe.
Thank you, Dr. Griffin. So in closing, East Orange, we just want to remind all of you that on Friday and Saturday, which I mentioned earlier, that there would not be any food distribution, and it would, we know that there's a holiday on Monday, that there will not be a food distribution on Monday. We will start back on Tuesday at 10 a.m. All right, and that'll be at 90 Halsted Street, and also on that Wednesday at 120 Rhode Island Avenue with Mayor Ted Green and Councilman Bert Lenius and Councilman Vernon Pullins, and that's at 5:30. That's an evening distribution, food distribution. Also, don't forget about our movie night, and we will be featuring the movie 42, starring the late Chadwick Boseman, who just passed and transitioned to God. And it's going to be a great day to come out and show our not only our respect, but also our condolences to a gentleman who has been doing an outstanding job. Also, and that movie night will start at East Orange Campus High School, 344 Prospect Street, starting at 8:30, but the doors are going to open at 7, so we can get in there, separate, be safe, but have a good time. Again, so please join us for our movie night. Also, just a reminder, our Pride Power Fitness Center that we have here in the city of East Orange, where we encouraging our adults, teenagers, and young kids to get involved in physical fitness, like taking care of yourself, especially during this COVID, but also following the guidelines still of our governor and the city of East Orange, and making sure that we keep ourselves safe. But we also want you to have some physical fitness. Also, I said earlier, to our young people who are going back to school, we want you to stay focused, we want you to stay engaged, and we want you to be patient. We know that this year will not be an easy one for you, but we are all here working together through this pandemic, and we're going to make sure all of you get through it as we trying to get through it. We know we are here to support you, right? And if you need any help from any of us, from the superintendent to your board members, down to the teachers, down to the council members, down to the mayor, please reach out for us because we are here for you. So again, we wish all of you well on your first day back to school, a day after Labor Day. We know you can do it. You have been doing it. You have shown the world how great you are. You have shown the world who you really are during this pandemic, and you did it. And we know for a fact that all of you are going to do it again because we're going to do it together. So we wish all of our young people a successful and healthy year 2021. Let's go East Orange. That's that East Orange pride. And we can't forget about our census 2020. We have been driving this message for the last 4 to 5 months, even during this COVID, how important East Orange, I'm going to say that again, how important for all of us to fill out the census 2020. If you filled out your census 2020, that's great. But I'm asking all of you tonight, if you're going out this weekend, if you're going to be somewhere during a holiday, remind your family, your friends, your neighbors, if they did not fill out the census, it's important for our city to be counted. Again, if you look on our Facebook page, we listed the numbers in English, Spanish, and Creole. So again, follow those numbers. If you don't have a computer, you can go on the telephone line and you will get assistance so that we can be counted. I ask you, beg you, plead to you, please fill out your census 2020. That's how we get funded here in the city of East Orange. That's how our hospital gets funded. That's how we get our public safety from our police department, fire department, our health department. That's how you see that we get funded for our school district and for our street paving and milling. We need you to be counted. So again, I'm asking all of you from now until October, 5 people. I want you to reach out to 5 of your family members or your friends or your neighbors and just remind them, hey, have you filled out your census? If they say yeah, then remind them to remind 5 people, all right? And then we're gonna go into our November 3rd commitment and making sure that all of us reach out to 10 to 20 people going into this up and coming election. The November election is just as well as important than any election that we ever been in. So with that, East Orange, our conversation night with my panel, I thank everybody for being here. We gave you numbers. If you have any questions, concerns in reference to the mayor's office, please call the mayor's office of constituent services at 973-266-5151. You can ask for Aja Baldwin or Justin Brown, or you can also speak to my chief of staff, Tony Jackson. With that, we're going to close out tonight. We thank all of you for always being here for us, because we're going to always be here for you. We thank our East Orange Council also, who has been partnership with us during this whole COVID conversation and meetings. This weekend, we wish all of you well. We want all of you to stay safe. We want all of you to stay healthy. We want all of you to just, again, stay mindful that this COVID and this pandemic is not going away. It's still here. But because of all of us being committed to making sure that we take care of ourselves and our families and our friends in this community, we are doing very well. So I wish all of you the best. Love all your guys. Let's love each other. But at the end of the day, may God bless you. May God bless your families. May God bless East Orange. Let's go East Orange. That's the East Orange pride.